Hey guys, welcome to A Sip of Aesthetics. I'm Dr. Abraham and I'm here with Lindsey today, and we're talking about different treatments for different ages.
Yes, thank you for having me back. I love your podcast.
Of course, we love having you here, and it's an interesting topic for sure.
Yeah, and I feel like more and more I'm seeing people even in their 20s and 30s. And it's like, what kind of approach should you have with that age group? Because now that the aesthetic field has been in practice for decades, we kind of know the do's and don'ts of like long-term
Yeah.
type of
And I
approaches.
feel like it's reaching, this whole field is now reaching more and more people, and more people are interested in it. And sometimes people come in and they want to start earlier. And I think it could be a very good thing as long as, you're doing the right thing and you're starting with the right treatments, because you're not going to treat, somebody who, maybe is in their 60s and has, so much sun damage and, problems over the age, the same way you might treat somebody with, in their 20s or 30s.
Yeah, like there's kind of this phenomenon. Some people label them as the Sephora kids, but really young adults or even teenagers who are being targeted and shown ads or influencers online to kind of start using skincare products, for example, or to start doing different treatments that are related to injectables or skincare
Yeah.
very early on. So it's
Yeah,
interesting.
I do agree, and this is one of these things where you have to be cautious what kind of information you're getting, right? And because some advice, like staying away from certain products and taking care of your skin, even in an early age, staying away from the sun, using sunscreen can be very beneficial. But some other advice can be really not good advice at all, and when it's like a very, let's say, aggressive treatment that's kind of a bit of an overkill for somebody on the younger side, for example.
Yeah, I've even had people show me a filter and tell me to make them look like the filter. So it's like very interesting AI type of approach.
Awesome. So let's maybe dive in a little bit deeper and talk about maybe some of the kind of younger generation and what kind of treatments we can do for them, and then maybe we can work our way through, and we can talk about people in their 50s, 60s, 70s, 80s, even, and what kind of treatments might be appropriate in that case.
Yeah, I do believe in good quality skincare for these younger generations. Sunscreen, absolutely, number one. And then there are some really high tech medical grade products that we have here that are simple, like the Elastin line, that's very regenerative or just can kind of maintain hyaluronic acid or have antioxidants in it to preserve their youthful skin from pollution, radiation, blue light. We're in front of screens all day, and so that blue light can have quite an effect over time. And then maybe light treatments with injectables as needed based on their skin quality, their face type, their genetics. They might use a light treatment of a neurotoxin or a dermal filler if they happen to have a deficit, like a recessed chin or something that needs some correction at a young age. Otherwise, we really minimize the injectables and especially 20s and 30s.
Awesome. So 20s should really be focusing a lot on preventative treatments, keeping their skin young and healthy, and then only adding injectable and other treatments kind of as needed on a base by base case, but kind of keeping that more less, let's say, more minor, I should say.
Yeah, I tell people to plan on coming in twice a year for their neuromodulators and just to do kind of a skin assessment and determine what they need as far as products. And then late 30s into 40s is when we see more atrophy and kind of volume changes that happen in the skin. And so at that point in time, definitely we use a lot of biostimulators to just also preserve existing collagen or promote good, healthy collagen in the skin. Again, you could kind of approach volumization with dermal fillers as needed. And then the energy-based devices really become important in their 40s to just maintain the elasticity and firmness in the skin. And I usually tell people that where they start is where they stay over time. So if you start those procedures in their 40s, they will very gracefully age. They'll still age, but you can maintain it so well. You can maintain a really healthy skin quality and not have to backtrack so much compared to if they wait until their 50s, for example.
Beautiful. You mentioned energy-based devices in there. Can you just explain a little bit more about that?
Yeah, so for like late 30s into 40s, I usually use less aggressive treatments. You could use radio frequency or things that don't have much downtime, microneedling with radio frequency. You could do light CO2s, chemical peels, but things that don't really need too much downtime, and those patients are typically working or having busy schedules anyway. And so you kind of just can get away with those lighter treatments. Whereas as the skin ages or as there becomes more severe laxity, age spots, photo damage, then you get more aggressive with like CO2, endolift, or things that can promote quite a bit more regeneration.
So now we're talking about like maybe somebody in their 50s or 60s, and that's when you would start using more of these treatments.
Yep, it's hard if somebody hasn't really done much in terms of maintenance into their 50s and they come in their 50s. Usually they're pretty frustrated, and it takes quite an effort over 1 to 2 years even to really get them to a happy place if they've never done anything. But with that patient, we definitely have to hit all the key points in terms of changing the volume in their face, lifting the skin, resurfacing the skin, addressing photo damage, and then using neuromodulators and skincare. So it's a little overwhelming for those patients. If they've kind of done some maintenance prior, then they're used to the conversation and they kind of know what to expect from these like non-surgical procedures too. It's a little easier.
Awesome. So, because I think a good thing to also kind of touch on is why do some people maybe age a little bit differently in a sense? Why somebody in in their 50s or 60s might look much different than somebody else in their 50s and 60s. Like they can look a lot older. I think one thing you've already mentioned is whether they've been having treatments earlier on in their 20s, 30s, or 40s. That makes a big difference once they get to in their 50s and 60s, how they look and what kind of treatments might be appropriate for them at that time.
Yes, absolutely. And then they've had those discussions. It's not such a shock sometimes too, when you have to kind of explain all the different factors and pieces of the puzzle that work together, from the bone aging, the fat aging, the muscle, and up into the skin. Yeah. Sometimes hair, everything.
Why do sometimes people like age differently in a sense in the way they look? Like, how come you see somebody in their 50s and they might look like, like they're in their 30s, and somebody else in their 50s might look like they're in their 60s or 70s?
Yeah, like a lighter skin type like myself, real ginger, we just have genetically a little thinner dermal layer, a drier dermal layer. We absorb all the light and create more kind of damage and more skin spots over time. And so someone like me really has to be cautious with like sun exposure and probably do a little more maintenance over time. Someone with maybe a deeper complexion or thicker dermis has a little bit more reinforcement over time. And so sometimes with them, really say like a Indian skin type or even Middle Eastern skin types, I've seen them like with beautiful complexions, even in their 50s and 60s, despite not doing a whole lot. So it definitely depends on the skin type for sure.
And I think this is honestly very informative what we're doing, like what you're talking about. Kind of dividing these people in different age groups, but obviously everybody's a little bit different. Sometimes people need to start younger just because of how their skin's aging versus some people, like you just mentioned, can go into their 60s and 70s and still look like, you're like, you've never had anything done and you look that great. But like, so if I'm understanding correctly, things like genetics also play a factor. And I do always kind of like to think of things about like, kind of group things into things we can control and things we might not be able to control as much. So maybe when it comes to our skin and aging, things like genetics we might not be able to change as much because we're born with it. But things we can control are things like taking care of our skin, staying healthy, doing these treatments throughout.
Yep. Sleep is a huge one. You get so much repair and regeneration of your tissue if you're able to have decent sleep. So people that just have very stressful lives, they're traveling a lot, and their sleep schedules are often kind of inconsistent, it can really take a toll on their skin.
I'm in trouble then because my sleep schedule is really bad. But I do agree, lifestyle things in general, sleep is a huge one. But even like, I feel like diet, exercise, all that stuff, taking care of yourself.
Yes.
All play a role, sunscreen.
Like some people kind of consider some of these aesthetic treatments as almost like superficial, unnecessary, but it really is self-care. And now that there's all of the regenerative type of approaches too, you can really get benefit long-term in just maintaining the health of the skin, kind of addressing precancerous lesions or whatever you need to address if you're speaking with someone just in general.
I think that's very important to say and to stress out because so for whatever reason, some people, when they think of aesthetic, the only thing that comes to their mind is like overfilled
Yes.
cheeks and like, unnatural
Catwoman.
exactly, like the very unnatural eyes or lips or things like that. But that's not typically what the field is about. Sure, it can be overdone in certain aspects with certain things, but there's a lot more to the aesthetics medicine industry than just those alien-like cheeks and things like that.
I know it's unfortunate that those exist so much in the wild, and some injectors are the exact same. And it's like some people just go way overboard. But when I tell patients that I pretty much like, you name it, I do it, then they're pretty surprised a lot of times that you can get away with doing something that doesn't necessarily come out looking unnatural.
Yeah, no, and I 100% agree. I mean, you need to take care of yourself, including taking care of your skin and the way we look and present ourselves, for sure. So, is there an age that maybe like too young to start, or an age where it's too old and we shouldn't do anything anymore?
I think if people come in 18 to early 20s, a lot of times I will caution them against doing anything too invasive and kind of just redirect them into skincare maintenance. And then as people go beyond 50s, 60s, a lot of them become surgical candidates. And if they're interested in fixing problems, sometimes you have to just really give them the right expectations when it comes to what we can do with non-surgical approaches. And a lot of them don't want to do surgery, but then you have to kind of know when to refer that patient to a surgeon if that's what they're interested in, or kind of tell them the limitations of what we can do. But past 60s, it is harder to address someone's either degeneration in the face, volume balancing, skin quality. And so you just really have to set them up for what they can expect out of treatments.
Yeah. And I think, again, like what you mentioned, the expectations, but also whether they've had treatments before and what they're trying to change. Because, I feel like if somebody is, maybe in their 70s, but just for example, the lips are really thin and they just want to improve the lips, then there's no problem doing that. But if they have, extreme jowls or they're very saggy and they want to completely get rid of it, then, the answer might be, more surgical in that case, as a better option to give them the results they want. So it really depends on what kind of treatments they're doing. If they're that age, but what's concerning them, for example, again, just as an example, like maybe some hyperpigmentation in their skin, then we can still treat it with a laser. But again, some other things like really heavy eyelids might need surgery. So it really depends on the concern and where they are at that point. Awesome.
Absolutely.
Well, thank you for coming today. That was great and very informative.
Always fun. Thank you,
Always happy
Dr.
to have you.
Adam.
Thank you. Thank you guys for listening. Like, subscribe, comment, and see you next week.